Hello, my name is Elizabeth Mason. I'm the Director of Recruitment and Selection for the School of Health Sciences at Bangor University. This short presentation is to provide you with some information around the Bachelor of Nursing degrees and the careers you can expect as a registrant working in those fields of practice. So nursing is field specific, so that means we offer degrees in learning disability, mental health, adult and child field. Now, you do have some shared learning, but at the end of your degree, you would register in your field, your chosen field of practice. So it is important that you do think about which field of nursing it is that you would like to apply for. And you do some research in terms of finding out what it is that a person in that field of practice would actually do on a day-to-day basis. Each field offers a different range of specialisms and can include working in the primary care setting, so that's in the community, in community teams. It can mean working in the secondary care sector, so that's working in a hospital. Obviously, the field of nursing that you've chosen to enter will determine the kinds of placements and learning experiences that you would have during your degree and the kinds of careers that you would be looking for afterwards once you have registered with the Nursing and Midwifery Council. Each of those fields of nursing offers a really good range of career options, but not just that, but you'd never stop learning as a nurse. So there are career options. So you work initially as a newly qualified nurse. You find out which of the areas you enjoy working in most. You may have already done that during your practice placements while you were a student. And then you can either apply for different posts, but also you can do CPD, so continual professional development, to gain additional knowledge that will help and support you to develop your nursing career. If you have a look on the NHS Careers website, you will see just how diverse the careers in those four fields of nursing can be. So it really is important as part of your application process that you have a look at the NHS Careers website and just see how your career can develop as a future registered nurse. I suppose just to summarise, an adult nursing degree is the broadest of the four. Now, you're not training to be a general nurse, you're training to be an adult nurse. It allows you to work in most of the settings, which include hospital, general practice, prisons, schools, and in the voluntary sector. So a number of my students have gone off and they have developed their careers, and I see them coming back to do CPD, and they're working in a whole range of different settings as their career has developed. Children's nursing degree, sometimes you'll see this as children and young persons. So you're caring for from obviously a baby up to the age of 18, so adolescence. And this will set you up for a career working with sick or injured children. And again, this can be working in schools, hospitals, so the primary care setting, the secondary care setting. Other places would include maybe the children's hospice or working with a charitable organisation. Learning disabilities is slightly different. So whilst you are a registered nurse, a lot of it is about helping and supporting the person with learning disability to be as autonomous as they can be. So you're there to understand their health and care needs, but also there to help and support them in their daily activities and care for their mental and physical health. Mental health nursing again covers the lifespan, so it's from childhood up to the older adults, and it focuses again on looking and supporting people, looking after people, supporting people with their physical and mental health needs of people with a range of mental health conditions. And that can be from, some of the things like maybe depression to some of the more severe mental health conditions. Again, you may work in a community team. You may be working, for example, with drugs and alcohol team. You may be working with a community psychiatric nurse. You may work in the acute setting, maybe working in one of the hospital settings that we have for patients who need acute care during their mental health conditions. I would really suggest that you have a look at the NHS Careers website, but also look at the Times Higher Education what can you do with a nursing degree? If you put that into Google, you'll find out there's a whole wealth of careers that you can enter into with your nursing degree. Now, our curriculum for 2021 is going to be made up of generic and field-specific modules. So you will learn about your field of nursing, but most importantly, you will learn about, what's it like to be, say, for an adult nurse. You will need to understand being able to care for people with physical conditions, but also mental health conditions. The same, you will need to understand how do we actually provide care and best support people in the acute setting for patients with learning disability, because they get the same kinds of illnesses as everybody else in society. So as a nurse, you have to be able to understand their needs in terms of learning disabilities, but also be able to provide the care that's needed for their health condition at that time. So we have what's known as interprofessional learning. Now that will take place in the classroom, but most importantly, in your practice placement setting. 50% of our course is theory, 50% of the course is practice, undertaken in practice placement learning areas where you'd work with a practice supervisor and a practice assessor to attain the competencies needed for your particular field of nursing. What we want to be able to do is to develop you to have the knowledge and proficiency to deliver person-centered, evidence-based care. So that is why, nursing is an academic program. It's not just about the skills, it's about understanding why you do things and being able to implement evidence that's appropriate for that person's particular needs at that particular time. So as I said, it's 50% theory, 50% practice learning. And what we are using is a blended learning approach. So you may be face-to-face in a classroom, you may be face-to-face online for a lecture. It just depends on the type of learning that you need to undertake for that particular session. So you may have clinical skills videos to look at home in your own time, but then you would come into either the school at Von Halog or at our Wrexham campus, and you would undertake that clinical skills session in person. We do use our virtual learning platform, Blackboard, to provide you with a range of other activities, which may be sort of directed learning activities to help and support you to cover the range of topics that you would look at as a student nurse. So in a typical course, you would be looking at things like sociology, psychology, anatomy, physiology, pathophysiology, pharmacology, nursing theories, grief theories, law and ethics. So there's a whole range of subjects that you can actually cover as a student nurse, because you have to have that theory to be able to apply it to patient care. Talking about our practice placement learning areas, you can see there that is a map of BCUHB, so Betsy Cadwallader University Health Board. And that is one of our main practice placement partners, but not the only one. We work with a range of providers for your clinical placements. And we try to allocate you as close to your home or term time address as possible. But it is important that you do get a range of practice placement experiences. And that may mean traveling to different hospitals, different community teams, so that you can work with different people and gain those experiences. I mentioned that we have our campuses. So we have a campus at Bangor, and we also have a campus at Wrexham. But obviously we work with our students in the community teams across the whole of that footprint. But our main hospitals are Ysbyty Gwynedd, Ysbyty Glan Clwyd, and Ysbyty Myler. There's also some community hospitals as well spread across that footprint of BCUHB and of the community teams as well. So a range of practice placement experiences that you would have. For child field students, you would also maybe go out of Wales to gain some of the acute care with one of our other practice placement providers. So all of our courses lead to registration with the Nursing and Midwifery Council. It's important to note that this is a full-time course, and by a full-time course I mean it's 52 weeks with 10 weeks annual leave. It's not really delivered in the same semesters or the same format as the rest of the university, where you would start in September and have exams in January, go into semester 2, start your semester 2 modules, and then have exams towards the end of May, beginning of June, and then be finished for the year. Our course is a full-time course, so the Nursing and Midwifery Council requires that you do 2,300 hours theory and 2,300 hours practice. So that's 4,600 hours over 3 years. And if you get your calculator out and you divide that by 42 weeks, you'll see that a typical week is around 37.5 hours a week, either theory learning or practice learning. So for the theory, it doesn't mean that you're going to be in the classroom for 37.5 hours, but that is, that's the baseline of your commitment to study to complete this degree. So some of that, as I said, will be face-to-face in your campus of choice, but also it could be through directed learning activities using our virtual learning platform. For practice placement learning, we do ask that you do the hours that the practice placement demands. So that could be earlies, lates, shifts, long days. It could be weekends, bank holidays, but also you do have to do some night duty as well, because it's really important that you understand the 24/7 nature of care provided by the National Health Service. We still have funding, so our courses are funded by Health Education Improvement Wales, and it's an NHS bursary which covers your living costs. So you do have to apply for this, and it is means tested. All of our students get £1,000, and then you apply for the other aspects of the NHS bursary from a means tested perspective. Our fees are also paid until further notice by HIW. We also have the Coleg Cymraeg Cenedlaethol Scholarship Scheme. So if you want to study through the medium of Welsh, either in theory or for your practice placements, we're able to organise that for you, but you have to apply for the scholarship scheme. And it's important that you do have a look online on the Bangor University website or the Coleg Cymraeg Cenedlaethol website to look at the closing dates for those particular scholarship schemes. You can see there, that is the web address for you. Now that's just a short overview of some of the information that you need to know about becoming a registered nurse in one of those 4 fields of practice. We have lots of information on our website for you to have a look at, but most of all, it's really important that you speak to one of our team. So come to our virtual open days, come to our face-to-face open days if those are in place for the autumn. We can then provide you with the information that you need to make an informed decision. I can't say how exciting a career in nursing would be. The opportunities for career and career progression are endless, but also the course itself gives you that foundation to be able to become a registered nurse and start that journey for you. Thank you for listening.